treatment boots and accessories. Upon designing the PRESOR 03 Excellence unit, special attention was paid to the characteristics and design of the treatment accessories, since the efficiency of the unit also depends upon these. These accessories are made of extremely resistant materials and are easy to clean. The foot accessory includes a rigid sole, which is very efficient in the correct application of these treatments. The different compartments are superimposed as if they were scales, guaranteeing uniform compression throughout the entire treated area, thus avoiding backflow or liquid accumulation areas. The corset-type accessory allows completing treatment of the abdominal area. The treatment accessories are connected to the unit by means of adequately numbered flexible tubes. The connecting system is simple and quick. Treatment modes. PRESOR 03 Excellence has 6 presotherapy treatment modes that are adaptable to both the upper as well as lower extremities. Mode 1 or maintained. Mode 2 or groinal. Mode 3 or physiological. Mode 4 or sequential. Mode 5 or lymphatic. Mode 6 or combined. Presotherapy programs. Each operating mode has 9 predetermined programs, in which all parameters, inflation time, treatment time, pressure in each compartment are preset. Programs 1, 2, 3, 4, and 5 are for treating the lower extremities. Program 1 determines the lowest pressures, and Program 5 determines the highest pressures. These programs are preset with pressures for 7 segments, from 1 located in the foot to 7 located in the abdominal corset. Programs 6, 7, 8, and 9 are for treating the upper extremities. Program 6 predetermines the lowest pressures, while Program 9 determines the highest pressure. These programs are preset with pressures for the first 5 outlets, since the tubular accessory for the arm has only 5 segments. Indications and contraindications of presotherapy. Presotherapy constitutes a very effective multiple-stage method of circulatory treatment in healthy patients to prevent the process. In patients who already have circulatory disorders, heaviness, edema, and so on, so as to treat the process and restrain its evolution. In the treatment of post-surgical edemas, such as the one that appears on the arm after a mastectomy. In the treatment of obesity and cellulitis. In the prevention of thrombosis in patients confined to bed or with little mobility. In post-traumatic edemas. In post-aesthetic surgery, and especially after liposuction. Prior to application, any circumstance that represents a contraindication to presotherapy and thus prevents its application must be discarded. Recent thrombophlebitis or phlebothrombosis, lymphangitis and skin infections, very severe varicose veins due to the risk of thrombus, important blood pressure disorders, neoplasia, cardiocirculatory imbalance, and important heart, kidney, or respiratory failure. Presotherapy physiological treatment with PRESOR 03 Excellence. In this case, we will carry out the presotherapy treatment without prior blood pressure medication. The tubes are connected correctly, taking into account that the numbers of each segment should coincide with the corresponding outlet of the unit, so as to obtain adequate inflation and deflation sequences. Number 1 should be connected to the foot accessory, number 2 to the segment furthest away from the boot, 3 to the following segment, and so on up to tube number 6, which is to be connected to the closest segment that corresponds to the lower abdomen and gluteus. If desired, any product that makes the treatment more pleasant can be applied, such as hypothermalizing lotions or relaxing gels. As in the case of any good drainage treatment, presotherapy has a strong diuretic effect, and therefore it is normal for the patient to feel the urge to urinate during or after its application. It is recommendable to inform him or her of the convenience of going to the bathroom before starting treatment. Use the protecting accessory that helps to keep the hygiene of that particular and successive patients. The patient makes her or himself comfortable on the prepared accessories. For better drainage, it is recommended to keep the treated area slightly raised. When applying the feet accessories, special care should be taken in making sure that the rigid sole covers the entire sole of the patient. The rigid sole makes the compression go inwards, thus guaranteeing drainage of the venous sole and correct beginning of the treatment. Fit the boots, adapting them to the contour of the leg. It is very important to start with the groinal area, to which the boot should adapt perfectly, so as to ensure correct drainage of the ganglionic chain in this area. The Velcro fastener allows correct adaptation to the contours and perimeters of each person. Each boot is continued with an abdominal semi-corset that offers optimum treatment of the gluteus, hip, and abdomen areas. In its most distant portion, the boots are placed over the foot accessory. As this is an accessory that is independent of the boot, it can be adapted to different leg lengths. Press the main switch. The heading message appears on screen for 2 seconds. After selecting the language by pressing any of the keys located below each one of the languages, the parameter selection screen appears. Select the operating mode to be used. Each time the operating mode is changed, the corresponding indicator light goes on and all operating parameters in general change, except for the program, which is always Program 1. Remember that for treating the lower extremities, Program 1 is for lesser pressure, and Program 5 is for greater pressure. When a specific program is selected, all treatment parameters appear preset: inflation time, standby time, and treatment time, although these can be modified at will so as to adjust them to the patient's needs. The PRESOR O3 Excellence unit allows establishing a dynamic pressure gradient, which is very advisable in most drainage. The pressure to be reached is programmed decreasingly, in such a way that it will be maximum in the most distal segment and will decrease down to a minimum in the proximal segment. The pressure values for the different treatment programs have been set in accordance with this concept. Generally speaking, the treatment is started with low pressures that will increase gradually in the same session and in successive sessions, taking into account the following pressure margins. Low pressures from 30 to 50 mercury millimeters. Medium pressures from 50 to 90 mercury millimeters. High pressures more than 90 mercury millimeters. As a general rule, the operating pressure should always be lower than the patient's maximum blood pressure, systolic pressure. This ensures that the compression does not interfere with normal artery functions. In young patients, the treatment can begin with higher pressures, while with older patients, we must be careful and begin treatment with lower pressures. If